Dr. K. Mookambika. She has a diverse experience of dealing with patients at both coasts of India. She has a few articles on a unique topic to her credit, which is dietary management of depression and alopecia areata. A dynamic teacher currently working as an assistant professor in the Department of Organon of Medicine at MNR Homeopathic Medical College, Hyderabad, Telangana. Welcome, ma'am. And Dr. P. Babravi Priyadarshini, as repertory is the best tool in a homeopath's toolkit, and Dr. Babravi is the best craftsman to familiarize this indispensable tool to the current generation of upcoming homeopaths. Currently working as an associate professor in Department of Repertory at Hamsa Medical College, she has done good amount of work on the clinical utility of fever chapter of BBCR. Welcome, Dr. Babravi, ma'am. And with this, we would proceed on to our session, the question and answer session. So I would request all the speakers to please put on their videos. Welcome, ma'am.
Thank you, madam, for nice introduction.
Thank you, thank you. Welcome, welcome, ma'am.
Thank you, ma'am.
So in today's discussion, we would be covering most of the topics, all the spectrum of illnesses which a woman would be facing in the different phases of her life, right from puberty to menopause and in the elderly age group. So with this respect, we would also focus on how homeopathy is her best friend, right? So we'll quickly touch the different aspects and let us move on. So pertaining to puberty, I would like to ask Dr. Rani, as we all would agree, Dr. Rani, that the incidence of thelarche is a lot of concern for parents these days, right? So what could be the causes which evoke this condition, ma'am? Excuse me, ma'am, you're on mute.
Well, so before discuss about this topic, I would like to say that in the present scenario, life of a woman is very challenging. You know, she demands many as a mother, sister, daughter, and a lover, of course, wife. So finding the time and energy to fulfill all these roles and cope up with her own needs can be difficult and can eventually take its toll on her health, right? So unfortunately, women health is ignored due to various factors. So women health is compromised at every stage of life, and from right to puberty to menopause. So this can affect her sleep, emotional balance, and energy levels. So that could even take her to depression, right? So that's why this topic. So what HMAT has chosen, that homeopathy, a woman best friend. So a very nice topic, of course. So I thankful to HMAT, Dr. Gopalakrishna Garu, Dr. Durga Prasad Rao Garu, and Dr. Sampath Rao Garu, and Dr. Venugopal Rao Saru. And so this is very nice topic. And at this moment, I will like to say that reproductive period of every woman is considered as one of the very healthiest period in her life journey. So during this period, her hormones balances her physically, mentally, socially, psychologically. So in her life journey, any one time she may develop problems due to the variation of these hormones. So whereas conventional method gives high doses of hormones to these persons, then they may afraid of taking these medicines because of deep action and side effects. So however, I am suggesting that homeopathy medicine for these problems without any side effects, undue pressure on the organs of the body. So why? Because homeopathy treats the patient who suffers from a particular disease, but not the disease per se. So, and it considers physical, mental, lifestyle factors in patients for the selection of medicines besides presenting complaints. So it is a holistic approach. So that's why homeopathy is a very best friend of women, I would say. So coming to that question, Dr. Annapurna madam, you asked about that. Can you repeat one more time that question?
Thelarc is a concern of many parents these days who are coming to our clinics. So how would we address that? What are the causes of Thelarc usually? Is it only emotional causes or is there any hormonal and other angle to it?
So yes, thelarchy. Actually, thelarchy means it is that beginning of breast development. So it marks the onset of puberty. Then puberty is a period of gradual development of secondary sexual characters. So although puberty is a transitional physiological period, lack of knowledge regarding the various physical changes and fear of the future imposes that considerable mental stress and anxiety in the minds of these adolescents. So, menstrual health and hygiene is a very rare topic of discussion at home and as well as schools. So, every girl should know about these aspects at schools, even at home. And so, that's why the reason why the girls are unaware of these complaints. And if you see that statistics, about 23 million women drop out or leave school every year when they attain puberty and begin to menstruate. Okay, so among them, because lot of women or girls ultimately end up so their career and their schooling, everything because of this acute health problem. So here the attainment of puberty, so it is related with the number of factors. So to attain a normal and healthy puberty, there are some factors are there like genetic factors, nutrition factors, body weight, psychological state, and social cultural background. All these are plays very important role. So any deviation of these may causes some problems at the puberty. Pertaining to these females, we call it is that early menarche or late menarche we call. Okay, so we have certain as a homeopathy treats according to the cause of these problems. If you see early menarche, so because usually in early menarche, what will happen? Before the 8 years, girls will having the secondary sexual characters, and it ends at that menarche at that before 10 years of age. So this is that we call it is early menarche. And probably there is that overweight. Obesity is the main cause of this early menarche. So basing on that, homeopathically we have certain remedies like antimcrude one very important remedy because it tendency to grow fat, and with that having that gastric spare, its action on gastric spare, and along with there is a thick milk whitey coated tongue, then we can think of anticrude. And calcarea carp, girls who are very fleshy, plethoric, so there you can use that calcarea carp. Then calcarea phos, so anemic girls who are very peevish, flabby, and cold extremities and like feeble digestion, we can think of calcarea phos in that. And very important remedy for as it females, it is that pulsatilla also we can use for this early menarche. And that along with that, one more condition about this puberty is late menarche. So usually in this late menarche, menstrual cycle may occur after the 16 years of age. because of that some feeble constitution, it may be delayed. So maybe unknown reasons, but family traits, we can think of that. So in such cause, if it is not there, so only feeble constitution, if it is there, then late menarche, we will treat homeopathically.
Correct.
So we
Ma'am,
have,
but
yes, we have certain remedies of that late menarche. So again, it comes as a pulsatilla. Pulsatilla, it the both aspects like early and late menarche we can think, okay, and we can think of that causticum. So the girls which is having that long-lasting grief, sudden emotions, like all these causticum can be helpful. Then graphitis and natramur also we can think the same way. Elements of the grief like fright, anger, like so we can think of natramur also. And again, calicar in the repertory that it is given that first menses delayed. So we can think of this calicarb also. And here that functional amenorrhea, we can think of one mother teacher like Senecio or yes. So we can think of this functional amenorrhea. So we can think these are the remedies related with the puberty.
Right, ma'am. Very well and elaborately explained, ma'am. So according to you, obesity is the major cause, and remedies which come up are antimcrude, calcarea carb, calcarea force, pulsatilla. And apart from that, you spoke about delayed menarche also, in which you spoke about remedies like causticum and natramur pulsatilla. Right, ma'am?
Yes.
And Senecio was the mother tincture, calicar. And Senecio mother tincture, which is useful in functional cases where there is no pathology involved at all.
Yes, there is no pathology
Right.
if it is there.
Thank you, ma'am. So next, after this, we would move on to Dr. Madhavi. Dr.
Yes.
Madhavi, assuming that the girl hits puberty at the right age, okay, still there is one more condition which is commonly seen in our clinics, which is dysmenorrhea. Really a debilitating condition. Every other young girl suffers from it. And apart from the congestive causes, which we all know is the commonest cause, is there any dietary angle to it or any emotional angle to it?
Before going to the question, first of all, I like to thank all the HPAT members for making me as part of this celebration. Thank you, ma'am. Thank you, sirs. Okay, as the topic is very relevant, homeopathy is the best friend for women. It is very rightly chosen topic, and it is very relevant and true also, because most of the female complaints, they are very amenable and very we can cure by our homeopathic drugs. Okay, right, ma'am. So coming to the topic, dysmenorrhea. Yeah, here more than, if you take the prevalence of dysmenorrhea, 50%, more than 50% of teenagers between the age group 18 to 25, they are suffering with dysmenorrhea. Okay. And in dysmenorrhea also we have so here we have to distinguish two types of dysmenorrhea, primary and secondary. Primary means without any pathology, you will have dysmenorrhea. It is most commonly seen in teenagers. And after 25s and after 30s, you will have secondary dysmenorrhea. Means there may be some pathology will be there, like some fibroids or PIDs and some endometrial, some other causes will be there. So that is due to some pathological condition, that is a different approach. So coming to here to the topic, in teenagers, it is very common. Why? Because it may be due to diet and emotional causes, and family history also is one of the important factor which leads to the dysmenorrhea, and sensitivity of the girls and low social support. Okay, these all factors like some emotions like stress, anxiety, all this affects the cycle in girls. Okay, so here we have one axis like hypothalamo pituitary ovarian axis will be there. If this axis function, means this pathway, if this pathway it functions normally, then you will have normal, usual menstruation is normal physiological. It should be physiological. But some are experiencing some symptoms and some problems with the menstrual cycle during reproductive life. Because of this changes in this axis, means hypothalamus, pituitary and ovarian axis, it should be normal. Okay, because of in the present scenario, stress, anxiety, diet, as madam said, obesity, all these are affecting hypothalamus. So if hypothalamus is affecting means pituitary as well as ovarian. So the hormones, all the female hormones are from ovaries. So all these will be affected. Okay. So here in dysmenorrhea also, progesterones will be more, which will stimulate the some prostaglandins like that. So because of that, many girls will be experiencing dysmenorrhea in their teenage. Okay, it is more from 18 to 25 years of age. So this can be corrected by appropriate homeopathic drugs. We have very good medication for dysmenorrhea, like and here in dysmenorrhea also we have different varieties like spasmodic, congestive and membranous dysmenorrhea. I won't go into detail of these types, but if we take the drugs, we have very good drugs like belladonna, chamomilla, and then nux vomica, pulsatilla. So pulsatilla is woman friend. So for everywhere, pulsatilla will be there. And not only that, we have other rare drugs like viburnum, viburnum. So that also, in many cases, dysmenorrhea is cured, or we can they get relieved by this viburnum. We should remember that drug also. And we have drugs, as we know, Magfos, Colocin, Laxis, Nux vomica. All these drugs, they will help in dysmenorrhea cases, in primary dysmenorrhea without any pathology. If we take secondary dysmenorrhea, we have to consider the pathology if they are having fibroids or PIDs or endometriosis. So accordingly, we have to choose the drug.
Right, ma'am. So as you have said, it is the stress, strain, insecurity, and anxiety, fear, which all affect the hypothalamo-pituitary ovulatory axis, right? And then there is an increase in the secretion of progesterone and prostaglandins. And very beautiful remedies with that, like belladonna, chamomilla, nux vomica, pulsatilla, magfos, colocin, and you can rescue with viburnum Q, right? So these remedies could be helpful in replacing the regular painkillers, right? Thank you, ma'am. Thank you, Madhavi. Now, next, I would like to address Dr. Umarani. Like, ma'am, every other teenager, apart from dysmenorrhea, what is seen commonly is premenstrual syndrome these days. So, ma'am, which are the remedies which are most useful in tackling this syndrome?
Yes, actually, health of a woman is highly dependent on her menstrual cycle. If a regular cycle without any symptoms, so then a woman can go for a daily routine, their social work and offices, colleges, everything. So, but here the PMS is that set of physical, emotional and behavioral symptoms that occur during the week preceding that menses. And in some patients, immediately after ovulation, the pain starts till that menses. So usually in the mild symptoms, mild, do not interfere their daily activities. So, but they can severe form, like associated with their disruptions in their work function, family, social relationships, everything. So most of these PMS symptoms usually they are irritable, anxiety, depression, fluid retention. Few people, they will tell that before menses there is a bloating of abdomen and mastodynia, we call breast tenderness, and constipation, diarrhea, like nausea, vomiting, cramps, like n number of symptoms women can feel before menses. And this homeopathy, only the solution for this conventional method, they will give like painkillers, only these type of symptoms. But homeopathy will consider each and every symptom of a woman. So that's why we have certain remedies for this PMS. before that remedies, that management of this PMS also helpful. So on all cases, no need of this medicine. Some like diet, exercises can reduce these symptoms. So that also we can educate that girls about this PMS. So according to coming to the therapeutics homeopathically, if PMS with constipation, then we can think of Nux vomica, Bryonia, Silesia, these three remedies. We can think. In that Nux vomica, there is an urge to pass stool, very frequent, but the stool passed is very scanty and unsatisfactory. So that type of constipation in the Nux vomica will be there. And Bryonia, there is very hard stool and dry stool. There is dry skin will be there, and dust for large quantities like symptoms will be there. Whereas Silesia, a lot of training is required in order to pass stool. But stool will slips back after that partially expelled. So this type of presentation we can think before that PMS as a constipation. Whereas bloating of that abdomen, like carbovate, China, we can think of this. And we know that China is the whole abdomen, like carbovate is the upper part of the abdomen. There is a bloating will be there. And lacasis and melilotus, we can think of headaches before PMS. Lacasis, then immediately after menses, then headache will be reduced. Then we can think lacasis, all the complaints aggravated before menses. So that in type also, that lacasis can be useful. Then conium and bryonia can be useful for the breast tenderness. So this is that most of the girls and women feel this type of breast tenderness before menses. And this conium and bryonia can helpful for this. And there is that hardness. There is that pain, intense hardness you can see in the conium. And this hardness is like severe, like stone. Female feels like there is a hardness like a stone. And pain also was by the touch. And bryonia, where there is a heaviness pain, and that female can hold the breast to get some relief. So like this, the symptomatology, we can think about the conium and this bryonia for the breast tenderness. And you can think of that depression, the mood swings. See there you can see ignition, pulsatilla can be helpful. Lot of remedies are there, but clinically in my practice, I use these remedies as a PMS. That ignition, pulsatilla can be for the this depression, mood swings before that menses, we can think. And whereas irritability, we can think of irritability before menses. Sepia and chamomile will be helpful. Sepia and chamomile will be in the irritable form. And you know that sepia very irritable before the menses, and the sepia lady very indifferent. So this few tall, thin, her stature. So these all helpful for that selection of the sepia. Whereas chamomilla, it is very irritable, accompanied by that even talking and coming, touching also very irritable. Like this, we can think of. And before the menses, I have seen some people having acne. Acne is that problem girls will facing before menses. That is sepia and natramur. I'll use that sepia and natramur before that acne. So these are the few remedies I frequently used for this PMS.
Okay, ma'am. So the various symptoms and the indications of different remedies, you have elaborated very beautifully, ma'am. But ma'am, before going to the prescription, do we have any specific investigations in these cases?
PMS investigations means we can think of about mild and moderate and severe symptoms basing on that. So
Okay.
mild symptoms, there will be a simple like diet and nutrition, then exercises will be helpful. In severe form, if all these symptoms basing on that. So if the breast tenderness, if it is there, or that 40 years of age, a female frequently having this, then we can think, go for that mammography. We can step on those conditions, like basing on that symptoms, we can go for that investigation.
Okay, okay, fine, ma'am. So from this, we would move on to Dr. Mookambika. Dr. Mookambika. So we are probably in an era where, despite there is good access to food, there is a lot of nutritional imbalance these days in the kids, which is also young females especially. So which is also due to the junk foods, the additives in foods, and different addictions as we see, right? So what is the way of dealing with these patients or such youngsters?
Okay, madam. Good evening to all of you. A special thanks to the HMAT and all the organizers. And thanks for giving me this opportunity. I would like to thank Dr. Venkateshwar Rao from MNR Homeopathic Medical College, as well as my institution, for giving this opportunity. Like going to the topic, like where these days we witness a lot of lifestyle changes, which are giving us a problem. So we all know that there should be balance, first of all, in anything and everything, whether it's positive or negative in that sort. So even having a very good nutritional food is very, very important, because these days I feel like a lot of influence from the social media platform or the TV is giving rise to, we are in a trend where we go into more of processed foods than the natural foods. So we feel like what the olden traditional foods are not a trendy, and then we get to go and buy your stuffs like that. And not only that, if we see the young females and everything, in the name of diet, either they completely go in abstinence of food, because the culture is for the more of people want to be very thin, and they want to fit into all the westernization and everything. So what basically they do is they go for fasting and everything, and they are not going for nutritional food or the quantity of calorie which is needed for a woman on a particular. And especially if you see the younger people, means for it's all all the mechanisms and everything is for the growth. So for the growth, definitely she has to be having more of calorie, because she has to do and achieve many things, but that is not happening. So I feel like because of the culture of becoming thin and fasting and everything, they are avoiding to take certain meals. They are becoming more of irritable, and they are not having a quality time with the family. And even because of the parents, because both the parents these days, yes, we have to work because of the financial constraint and everything. A quality time with the child is not spent, where even the parents are not able to counsel the young girls, like, this is not what you're supposed to do. So they are taken for granted, and they are not going for consumption of the good food, which requires good amount of protein and carbohydrates as well, and then all the vitamins and minerals which is necessary. And sometimes, like, not taking enough of vitamin B also causes a lot of damage to them. Like, not only vitamin B, all the vitamins are required. So they are going, either they're missing the meals so that they can maintain their figure, or because of the social media influence, they are adopting certain lifestyle, which in fact is having a lot of impact on their health system. So I feel like all this anorexia nervosa or binge eating, sometimes people go for bulimia as well, because of the stress which they are undergoing, maybe because the parents are not giving them enough time, so they are feeling lonely, so they depend on watching TV and everything. So in that meantime, they go on junking and everything. So I feel like more it's not only the duty of the doctor. Definitely we have to address this problem, but we have to also tell the parents that they have to spend a quality of time with the children and know what is their difficulty, which is more important, and spend time with them, ask them to have food along with them. Not like everyone in the family has a different timing for having food and everything, and the mothers especially have to take care of what their daughters are eating. Otherwise, definitely they are going to go for a low caloric diet, and which could lead to again menstrual related issues. They can even go for PCOS and all that related problems. So where we have to, like, I feel like a broader aspect of counseling has to be given to the parents as well, and certain, like, if necessary, cognitive behavioral therapy for the child if the child is suffering from bulimia or anorexia nervosa, plus dietitian. Maybe more of integrated approach is required for such people or such young girls. And some remedies, like, for example, China 6C is given for people who have lost their appetite and who are in need. Alpha tonic can be given if they are not able to eat. And then definitely antimicrobial, like how Madam had mentioned, that for people who are very fat and growing fat. And then definitely all are pulsating. I feel like it is more of a psychosomatic. So if we are able to deal with the mind, then definitely whatever, okay, if it has come to the somatic level, then maybe according to the symptoms, we take the totality and try to give a remedy. So these are the certain things. So finally, what I would like to conclude is, if your young one is suffering, it is the equal responsibility of the parent. They require a lot of patience and good quality of time, including such totality of treatment we can go for.
Right. So we would like to say that we have to become a counselor in this rather than a doctor. First, we need to
Yes,
counsel
madam,
the
definitely.
parents.
Yeah,
Yes.
yeah, definitely. Because brilliant thing with our homeopathy is we do not have, like, just take the complaint and give the
Correct.
medicine, right? We
Correct.
have to go through the multi-dimensional aspect. And
Correct.
definitely we can also have an integrated thing with the dietitian and
Exactly.
the psychiatrist.
The cognitive therapist.
Yeah.
Very well said, ma'am. And so, ma'am, once we feel that these are the causes, and these are the causes which also lead to irritability or which lead to anxiety. And
Yes.
there is some disturbance in psyche of the young girls these days, right?
Definitely.
So how does this impact their physical life, their health? Could you throw some light on that?
Okay, fine. For example, if I have to say, these days what happens, because women is also working and everything. Can you see me? Am I audible?
Yes. Yeah.
Okay, because these days the women are also working some amount of quality of time. If they are not able to spend with their child, what is happening is they have a sense of neglect. Basically, all the children will require some amount of love and attention and care from their parents. But once they are not receiving it, they feel so neglected that whenever they are put into some new environment, or suppose they're going and joining school or they're changing the school, they always have that threat and trust issues which are coming up. So what happens is, here the social thinning comes, like they cannot connect themselves with others. So there's a lot of mental suppression going on, and the reactivity for small stress becomes so much. Like small things which can be dealt easily, they react exaggerated in an exaggerated form.
Right.
So when the mind is undergoing such stressful things, definitely even the body is undergoing turmoil. And these days, if we see previous generations and all, there was no PCOS and very less infertility complaints. But these days it is increasing. One thing is because of the food, and another major thing is her hormones. So what is happening is, in this competitive world, okay, first is her neglect and trust issues. Then she has to compete with the upcoming, generation where, there is less opportunities out there. So they have to outshine. So what they do is, and also the parents compare them with the others. You have to be good and all that. So all this stress together, what is happening? She wants to do her best, So for that, even the body listens and it tries to, increase the testosterone levels. So this is in fact having a great impact on her body in causing PCOS and infertility issues. There is insulin imbalance, there is, androgens imbalance. So what I feel is a lot of psychosomatic things like mind, and then, the food also, and as well as, the parenting is also very important. And it is like, usually the thing is, if we are under some threat or some stressful condition, it should be our parents whom we have to first approach. But if as a parent we are not that much welcoming with our children, we are very strict, we are putting them under a very strict environment, whom will they go for? Okay, so wherever they get some attention or something, they will go for that, or they will go for addictions and stimulants and everything. So all over, there is a lot of need of attention from parents also is required, and the family members, I feel, have to play a lot of role in upcoming young generations, I feel.
Right. So, ma'am, are there any remedies which could be help of in this condition from our side?
Yeah, definitely. We can think of remedies like phosphorus, calcarea carb, then the carcinosin. For example, people who try to be little precautious than their age, and then the tubercular remedies. So the phosphorus, pulsatilla, all this, what is happening is the mentally they try to be precautious, so the body also tries to be precautious, so they attain their puberty early and everything.
So it is all fight and fright hormones which are playing their role.
Yes, exactly.
Right, ma'am. So, ma'am, from this also, if we can see that psychosomatic health also impacts the world-class obesity epidemic called obesity, which is going on now.
Yeah.
So, could you throw some light on that, especially?
Yes, yeah, like as I already told in the previous thing, because of the eating disorders, like some of them, because of the stress and the neglect from parents, like they immediately give them some source of like mobile or TV battery they go like that. So they also gather some junk foods and they keep on having it. No much of physical activity, because they are not able to tolerate small stress from social environment outside. They are preventing to go and play out, because always constant fight with the peers and friends. So what they do, they sit in the home only, keep junking and all that. So obesity, it contributes.
It's on the rise, correct. So what is the impact of obesity in these young girls?
Definitely our PCOS is coming up, and this PCOS is giving a lot of, because hirsutism, and then their confidence is going low again, they tend to stay back home. So in that way, definitely obesity is giving rise to all the issues, and at the young age only they develop arthritis also these days.
Right.
And diabetes, definitely, I cannot forget that diabetes is coming up at a very young age. So all the whatever they have to get, or not like I'm wishing that they should get, but usually what we call the elderly diseases are coming up very premature because of this lifestyle itself. So
correct.
We can,
right. So it is, everything has to begin in the family, the attention from the family. If it is not there, it affects the psychosomatic health, and then issues like obesity and PCOS on the rise because of this, right?
Yes,
thank you, ma'am. Next, I would like to address Dr. Madhavi. Ma'am, so as Dr. Mookambika has said that psychosomatic health affects the body, and there is an incidence of PCOS which is rising drastically these days. So we know there are obvious factors like lack of exercise, junk food, additives, and addictions, and the stress of studies in these days, right? So what are the various remedies that have helped you to take care of a young woman with PCOS?
Yeah. So nowadays PCOS is very common, very common, I say. In my clinic also, among 10 cases, if I get female cases, 5 cases will be PCOS, and in 5 cases, 4 will be with obese only. So obesity and PCOS are related, and PCOS also leads to obesity. So it is like a circle. So here PCOS causes may be, as madam said, change in lifestyle is the main cause, as well as diet, stress, and family history will be there anywhere. And
Correct.
obesity actually it initiates PCOS in 50 to 70% of cases. Means obesity is there means it leads to PCOS. I tell you the cycle here also because I teach physiology, so I I know this thing.
Ma'am, but apart from this, if we see, ma'am has already explained that how PCOS and obesity are linked. So if such a patient comes to our clinic, ma'am, like the patient is obese and she is having PCOS, so how do we help them? What are the investigations we can order, and which are the best remedies we can, give it to them?
Yeah, here obesity means so here in obese girls, what happens means adipose tissue will be more, so they will secrete more amount of leptin, and that will affect the insulin cycle. This point is very important. It will affect the insulin pathway. So what happens in them, there will be hyperinsulinemia will be there. Okay, so maybe they are not at that time, they are not prone to diabetes, but in future they are more prone to diabetes. So here investigations also we have to go through hormone assay will be there. So estrogens, progesterone, we have to investigate the levels, and prolactin one thing. Along with that, FSH, LH, and insulin also we should investigate, because in these cases insulin will be more, that leads to PCOS. So there is a research, that's why in allopathy also they will give anti-insulin therapy for PCOS. So that is the reason behind that. So in investigations also we have to see all these things. So there will be definitely estrogen levels will be more, and along with that androgens will be more in PCOS. That leads to hirsutism. So acne, all this hair growth, all these things will be there because of increased levels of testosterone, that is androgens. And LH also will be more. Actually, LH up to, if it is normal means it will help in ovulation. But what happens here means LH will be more because of insulin. So insulin also triggers LH to increase LH levels. So LH will be more. So that ratio we have to take, LH and FSH ratio we have to take. FSH will be normal, usually normal. Only LH will be increased. And prolactin levels also we have to investigate. Along with that, glucose, that is because it is dependent on insulin. So fasting glucose levels, these comes under hormonal assay. Apart from that, USG, that is normal. So USG, we have to advise ultrasonography. So we find cyst in both the ovaries or one ovary, like that. So USG will be very diagnostic for PCOS. And coming to the drugs also, we have many drugs. We can give obesity drugs also, like calcarea carb, graphites. And also here, what is the symptom means there will be delayed menses. So late menses will be one of the symptom of PCOS.
Ma'am, just a minute. Ma'am, in this case, when we speak that in allopathy, they are giving something to reduce the insulin resistance, right? So if the insulin levels are high, for example, in a young woman with PCOS, are there any remedies which we can address that particular problem, that particular investigation?
Lycopodium is lycopodium, it is both, we usually give for diabetes also. So here if we take in PCOS also, if you see in the repertory, tumors in genitalia topic chapter you will have. So tumors in ovaries, you see lycopodium.
Correct. So if the insulin levels are high, we can think of remedies like lycopodium.
Lycopodium and other drugs also according to the symptoms, like graphites, calcarea carb. And if tumors, this is if they are more on right side, we have certain drugs like apis.
Correct.
Lycopodium, and left side means laxis.
Correct.
So that all depends on USG findings.
Right. Any specific remedies for higher levels of androgens, ma'am?
Higher levels of androgens means we can go for sulfur, calcarea carb also. The hormonal for PCOS, calcarea carb will also work with higher levels of androgens also.
Okay.
Yeah. All these drugs, they will help in PCOS.
Right.
What I give in PCOS means we can give in millismal potencies.
Okay.
Millismal. Usually I try, I try. I give in some cases, if they are not responding to centesimal potencies, we can go with millisimal potencies. They will help definitely. Okay, like lycopodium 0/3, 0/6, or sepia or calcareous carb. Usually I give calcareous carb, sepia, lycopodium, all this in 50 millisimal potencies. That will help.
Right, ma'am. So definitely there is a role of investigations in all the prescriptions of PCOD, as ma'am has already elaborated. So next, let us move on to infertility, and I would like to call upon Dr. Babravi. So ma'am, after dealing with the common disorders of puberty, the next challenge that we face is with the cases of infertility, right? So patients usually shy away from the conventional mode of treatment, as we know it is very painful, and they opt for homeopathy. And I think PCOS and PID are the most commonest causes of infertility, ma'am. So I have a few questions pertaining to this. So we know that if anti-Mullerian hormone is on if the anti-Mullerian hormone is on the higher level, the ovulatory cycles are normal and there is enough ovarian reserve. Otherwise, if AMH levels are low, then there is definitely some cause and it is resulting in infertility. So what are the remedies which can help us increase the levels of AMH, ma'am?
Thank you, ma'am. Thank you for the question. And before going to answer your question, I would like to thanks HMAT and also Hamsa Homeopathic Medical College for selecting me for this session.
Thank you, ma'am.
And now coming to your question, when AMH value is low, how can we help for increasing ovulation? First of all, AMH is one potential test which will tell us about ovarian reserve. Okay, and patients who are coming to us with the AMH test report, their main concern is to conceive.
Correct.
So our motto in treating patients with low AMH is to make them successful conception. So a case with low AMH can be treated with remedies which can improve the quality as well as the quantity of ovum. Okay, in such scenario, we can try remedies like sepia, where patient is already taken some other system of treatments, and so much of hormonal intake has been done by the patient. In such cases, we can think of sepia. The causes for this low AMH is age. Elderly age people will have low AMH value, and also certain autoimmune diseases, hormonal changes, and PCOS. These are the common conditions where you see low AMH value. In such conditions like autoimmune diseases where your AMH level is low and your ovary itself is not supporting to produce, ovary itself is not supporting you to produce fertile ovum. In that cases, you can try of carcinosin, arsenicum, apis, pulsatilla, and you can also try folliculinum, which is very good drug in these cases.
Right, ma'am. So remedies like sepia, carcinosin, arsenic, and apis, pulsatilla, folliculinum are the remedies which can help us to raise the levels of AMH. Thank you, ma'am. Next one would be, ma'am, if AMH is normal, okay, and the most important concern is dryness of cervical mucus. So how could our remedies help in alleviating this symptom? Ma'am, you're on mute.
Yes. Cervical mucus. This cervical mucus is very important for conception because it is helpful for maintaining the healthy status of the vagina. And also it is one important factor which helps in transportation of spermatozoa to the ovum. When your cervical mucus is not sufficient for this transportation, and it also affects like painful coition. It also affects lubrication. All these things definitely matter in the process of or in the pathway of conception. So for increasing cervical mucus, if you search in your repertory, you can search under rubrics vagina dryness of vagina. When you refer Murphy repertory, there are 3 important drugs which are given. They are lycopodium, natramur, sepia. This helps in increasing cervical mucus and in also for successful conception.
Right. So lycopodium, natramur, and sepia are the most important drugs in this aspect. Right.
There are other drugs like medorinum, sepia, which will decrease cervical mucus, which can be indicated in decreased cervical mucus discharge.
Medorinum, right. Okay. Another important cause, ma'am, of infertility is the endometrial thickness is less than normal, right? So it is not able to hold the embryo. So any remedies which would help increase the thickness of endometrium?
Endometrium plays an important role in implantation once the ovum is fertilized with the sperm. If the endometrial thickness is not sufficient, the thickness, sufficient amount of normal average endometrial thickness should be around 8 mm for successful conception or successful implantation. If endometrial thickness is not to that point, then conception implantation failure occurs. In such cases, we can think of conium, senecio, xanthoxylum, dioscorea, pituitary. These are the drugs which help us in increasing the endometrial thickness. Senecio is very good drug where you have scanty menses, amenorrhea in young girls, and ammonium carb, Senega can also be used in these cases.
And what could be the indication of pituitary, ma'am, in this?
Pituitarinum is a vasoconstrictor, and it has an action on the uterus. It indirectly increases the flow of blood to the uterus. Like that, it will indirectly increase the healthy, it will maintain the healthy stature of the endometrium.
Okay. Okay, so remedies like conium, senecio, xanthoxylum, dioscorea, pituitary, ammonium carb would help us with this, right? Okay, after taking care of the endometrial lining, there are few cases wherein there is a chronic fallopian tube blockage due to some previous history of infection or PID or tuberculosis, maybe, which is most common in India. So, do we have any protocol for such cases, ma'am?
In this tubal block is mainly because of infections, or maybe because ascending infections from the vagina, or maybe because of some bacterial infections, or maybe because of some surgeries previous, or maybe because of C-sections, cesarean sections, or poor obstetric history. In those cases, we can, your fallopian tubes are blocked. In those cases, we can think of remedies which can clear these blockages. So we need to take symptoms. Basing on the totality of case, only we can treat. And the main important concern for this tubal block is transport of ovum to the uterus and fertilization of ovum in the tube. So here also the patient's main concern is pregnancy, conception. So we can think in this tubal block remedies like sinicifuga, calophyllum, thalaps, lachesis, euphionum, thiosinum, silicea, Silesia is the only drug mentioned in Murphy repertory for pus formation in the tubes, fallopian tubes. It is the only drug mentioned in Murphy repertory. So in case of pus formation, we can give this Silesia. And for removal of scar tissue, we can think of this thiocyanum. If the tubal block is with some inflammatory changes, then we can think of Merxol, Pulsatilla, Sepia.
Okay. So in case of an acute or subacute inflammation, we can think of Merxol, Pulsatilla, or Sepia. And when it is chronic and scarring has already occurred, we can think of Silesia, thiocyanum, which would beautifully act on the scar tissue. Right, ma'am. So, ma'am, probably if there are some cases in which there is no known cause for infertility, everything is normal on the female side as well as on the male side also. So, is there any particular miasmatic approach to such cases?
In such cases, we should take the patient's past history, any past health issues which they have occurred, so that we can take the miasm, how it is going. Like that, we can take the past history and the previous illness, whatever patient has undergone, all those things we can take, and also her life space, how she has brought up, all the things matter in constructing the miasmatic background of a patient who is normal in all aspects in relation with anatomy, physiology.
Okay, okay. Fine. So in such case, deeper acting drugs or any anti-miasmatic drugs which could be helpful?
Yes. In such cases, we can think about constitutional remedies, whatever suits to the patient.
Okay.
Like sulfur, medorinum, these drugs will help in such cases.
Fine. Okay. And sometimes we also see that some patients who wish to go for, after failure of all the therapy for infertility, they wish to go for IUI or IVF procedures. So is there anything from our side which could help them for going without failure?
After taking so much of treatments, so much of therapies, and finally they land into failure, in such cases, the main important cause maybe the implantation difficulties, or maybe we will lack the motility of the sperm from the male side. In that cases, we can think of drugs which will help the morphology, which will help to bring back the normal morphology of sperms. And we can think of the drugs which will help in keeping the uterus wall healthy, which indirectly helps in good implantation, like natrum car, sepia, pulsatilla. These are the drugs which help us in keeping the implantation proper and also uterus healthy.
Okay. So we definitely have a role to play in such cases also, which increases the chances of a successful IUI and IVF. Yes. Right. Thank you, ma'am. Next, we would move on to a few scenarios in antenatal care, which is one of the important phases of a woman's life. And homeopathy has a lot of scope over here, as most of the conventional drugs are contraindicated in these cases. So definitely patients would opt for homeopathy in such cases. I would like to call upon Dr. Rani. Ma'am, for a young woman who is planning to conceive or who has just conceived, what is the role of nutrients and supplements, ma'am? And do we have any homeopathic substitutes for these supplements?
It is very important to eat nutritious food before a woman wants to conceive or after pregnancy also, because good nutrition supports the baby during that first trimester, because during the first trimester there is that means 3 months. So there is a development of the organs starts, like lungs, heart, brain, and other important organs also starts to develop. Okay, so during this time, it is known as the organogenesis period, we call. And along with that, there is that during the first trimester, there is a gastrulation process starts. So there's a 3 layers and neural tube formation starts, notochord formation starts. Like very, very important aspect starts at the first trimester. So this is that very important period for that nutritious food, along with that very important folic acid. So folic acid is a very important nutrient. Every pregnant woman must take that. Otherwise, there is that neural tube defects in the baby may happen. So folic acid, that's why pregnant ladies in the... Hello?
Yeah, ma'am.
Yeah. So pregnant ladies, first trimester, folic acid must take that. It is essential nutrient. Okay, coming to here, this usually all women of childbearing age need 400 micrograms of folic acid in each day. Whereas pregnant women need 600 micrograms folic acid daily. So it is that nutrients usually we can found in the leafy vegetables, nuts, beans, citrus fruits, and there is a fortified breakfast like cereals, like vitamin supplements. These are all availability will be there for the folic acid. Coming to homeopathy, so we have certain supplements like calcarea fast is there. We can give that as a along with this folic acid. Okay. So this calcarea fast patients usually it helps to strengthen a woman who tends towards easily tired. So women usually tired, feeling poor digestion, and there is a cold hands, cold feet, and poor absorption. So like this type of woman, this calcarea fast usually helpful, and also ferrum metallicum. That woman who has that sturdy build and looks very pale. So this type of woman, the ferrum met useful, and ferrum fast also useful, and it will be helpful for that sensitive nervous people. So these supplements can be used along with these during pregnancy.
Right. So supplements like CP, Ferromet, Ferromphos, along with folic acid and other supplements. So
Yes.
both have to be taken together.
Yes.
Right, ma'am. Ma'am, and again, one more thing which comes up is usually pregnancy is a period in a woman's life which has to be enjoyed and cherished. But what happens is many of the young females today are suffering from symptoms like vomiting, like headaches, UTIs, or etc. Few symptoms during the first trimester of pregnancy.
Yes.
So can we help them in some way?
Usually during pregnancy means antenatal period, there are few certain symptoms a female will experience that. So like as you asked about that nausea, vomiting, and cough, UTI, then backache, constipation, piles, and indigestion. Okay, and there is a skin itching of the skin, like pruritus, like all these symptoms will be there. So here that homeopathy having lot of scope in antenatal period, because other system conventional method they don't give like painkillers much during pregnancy, first trimester, and even pregnancy also. So we have certain remedies which can help these type of symptoms suffering by that pregnant ladies. So if you take that nausea and vomiting, so usually in the first trimester and primary, usually that nausea, vomiting is that frequent complaints will be there. We have certain remedies, these type of symptoms. And if it is increased, means complete vomiting and nausea, then we call it is hyperemesis gravidarum. So this requires some specialization and IV fluids, and a specialist under that treatment should be given. And simple like nausea, vomiting, we have certain remedies like arsenic alb, we have that morning sickness, we have that very important and specific remedy, that is Symphoricarpus racemosa. Okay, that remedy we can give. It is a specific remedy. So it is having my personal experience when I was pregnant. So I used this remedy. It's wonderfully uses, and after taking this remedy, and also I got some confidence again about this homeopathy in this. So self realization and self experience is very important, of course. Okay. So this remedy is very specific for this hyperemesis. And then arsenic, we know that there is sight and smell of the food causes vomiting, and the woman will be very restless and fear of death and vomiting. These complaints, if female having, then arsenic we can give. Then colchicum, we can think of colchicum, and it is that odor of cooking food that causes that nausea, and there is a profuse salivation will be there for this colchicum. Okay, and epicock, so it is that nausea, constant nausea will be there for that epicock, even it is not reduced by that vomiting. Also there is very clean tongue will be there for that epicock, we can think of this. And also sepia, sepia, nausea with sore erectations, we can think of this sepia. And lactic acid, we can think of lactic acid, especially pale anemic. Then diabetic women, we can think of this lactic acid for this hyperemesis cases, whereas at morning sickness cases. And
Right.
other condition, we can see the toothache. Okay, because of this hormonal changes during that early pregnancy, there is a gums and teeth are more sensitive, and there is a bleeding of the gums and painful teeth. So these complaints usually that pregnant women will suffer with that. There we have certain remedies like magnesium carb. We can think of this toothache. Here the magnesium carb having that desires of open air, and here the chilly patient. So chilly patient at desires of open air. So this is the peculiar complaint. So we can think of magnesium carb, and this toothache will be worse at night time. The magnesium carb, and when quiet and the night time, cold air. So these are the worst things about the magnesium carb. And ratania, one more remedy, ratania for this toothache. And chamomilla. Chamomilla also, here chamomilla will have the female is having very irritable anger by nature, and that even aggravation from the coffee, we can think of that chamomilla. And one more remedy, it is a staphysagria. Staphysagria also, we can take teeth painful in touch, even also even touch of the food and drinks. Also there is a toothache will be there for this staphysagria. But when the biting and chewing, there will be no pain, only the touch of that causes the pain. So this is the PCOS symptoms, we can think of this staphysagria. And again sepia comes for this again toothache from the sweets, tea, like all these by that sepia we can think. So about these few very important remedies and specific remedies for the toothache in the pregnancy. And we have certain female is having problems like pruritus of the skin in pregnancy. So in the pruritus of the skin, usually urticarial papules we can see, but there is an itching of the skin continuously. So after delivery, then itching will be reduced. But during this pregnancy, there is very discomfort about this itching. So we have certain remedies like caladium. So here elements of insect bite. So then that is a burning and itching violently. So we can think of caladium. And creosote also we can think. And ambra gracia, there is that itching of the pudendum. So this and sepia comes again here even for this condition. So sepia, I think even after the pregnancy complaints, any skin complaints after that delivery. I have given a number of women about this skin complaints developed after the delivery, sepia. So we can think of this, okay? And one more thing, during pregnancy, headaches. Okay, so usually these headaches, instead of giving the medicine, the management are very important. So the pregnant woman should take rest sufficiently. So should avoid the stress and some exercises, some relaxation better she has to do. So apart from that, if she complaining that headache, we have number of remedies. Like again, the belladonna comes here, the headache, and Simsifuga comes here, the headache, and gelsemium comes. Again, sepia, spicelia, that right or left side, according to that, we can think of this headache, okay? And other complaints, usually during pregnancy, there is a increased abdominal pressure. So acid reflux will be there. So these may causes heartburn and indigestion in that pregnant woman. So we have certain remedies like acetic acid in this condition, and we'll have also capsicum we can think of here, and heartburn like nux vomica we can think about in these cases, and magnesium carb we can think of that, natrum phos. So we have remedies in that pregnancy, nux vomica. These are the burning and indigestion we have. And again, the frequent complaint in that here it is UTI, urinary tract infections. Okay, so here that this also management is very essential instead of medicine. So taking of the plenty of water and salts, these are very important for this UTI. And here that our remedies here play means EPIs we can think of UTI infections, and equisetum we have remedy in these cases, and creosote again comes here. And one more remedy like Helonias dio, like DIOCIA, Helonias. So these also having that. So these I have chosen some first grade remedies, like in my practice I have used. So these are the remedies useful for this pregnancy. And frequently suffering complaint like backache. Backache is that one complaint from that pregnant ladies. Like we have remedies for that. So we can think of Aeschylus hip. Aeschylus hip can think there is a lameness of the back. Patient will complain like that, lameness of the back and across that sacroiliac joint, and the pain goes from that continuously from the sacrum. So then lumbar region, lumbosacral region. So Aeschylus hip can be helpful, and arnica we can think of here. Rustox we can think, calicar backache. So it is that affinity is more on that back region, that calicar we can think of. Ledum pal, sarsaparilla, like we have numbers that backache we have. And last we can think of this constipation and piles. In the pregnant woman, there is that constipation and piles is one more commonest problem. So here also comes that Aeschylus hip comes as that here. So this is the constipation. There is a difficult, hard stool, dry stool, and there is that Aeschylus hip comes. And next, ammonium moor. Ammonium moor also we can think there is a hemorrhoids. These are very sore, and there is a green mucoid stools will be there in that ammonium moor. And we can think of collinsonia in these hemorrhoids, and these are the bleeding piles. Collinsonia, you can see that bleeding piles, and alumina we can think. So these are certain remedies can be used in that during antenatal care, and this during pregnancy we have certain remedies, and important symptoms can be treated by that
Right,
homeopathy.
ma'am. So, ma'am, the remedies which you have given, I think they are more than enough to replace antacids or painkillers or antibiotics in every household.
Yes, that's why we have a
Right.
lot of scope in that antenatal
Correct,
checkup.
Very
That
well elaborated, ma'am.
yes, that information should go to
Each
every
and every
pregnant
female.
woman.
Exactly,
So
exactly.
homeopathy having lot of scope in that area.
Right,
So
right.
because their conventional only they will avoid these painkillers during pregnancy.
Correct,
Certain
correct.
antibiotics will not be used. Okay.
Definitely, ma'am. Our remedies hold the upper hand in these conditions.
Yes,
So
yes.
now that we have understood so much about antenatal care and the role of homeopathy in antenatal care, let us move on to a few cases of pregnancy which we see in our clinics. So most of the common things we see in the clinic are that there are a few high-risk pregnancies. So these patients come to us during the first trimester. So what is our role as homeopaths and how can we help them keep the viability? I would ask this question to Dr. Babravi. What do you
Yeah,
have
ma'am.
to say, ma'am, according to this?
High risk pregnancy is otherwise called as difficult pregnancy. High risk pregnancy are those pregnancies which is complicated with some other diseases prior to attaining pregnancy, like diabetes, hypertension, thyroid disorders, along with your normal pregnancy. During the first trimester, this is very crucial period because lot of physiological changes are undergoing both in mother and also in fetus. So chances of miscarriages and chances of birth defects more during this trimester. So when we think of pregnant gestational diabetes, gestational hypertension, and pregnancy with thyroid disorders, we can think a set of remedies when coming to gestational diabetes. And like for gestational diabetes, we can think of cephlandra, syzygium, pancreatinum, chionanthus, retania, phosphorus, phosphoric acid. Phosphoric acid can be given to a patient in gestational diabetes with weight loss and weakness. Chionanthus is given for a patient who is on the borderline, of sugar levels. Pancreatinum is given to a patient along with this diabetic level. She is having some hyperacidity symptoms. Other than this, you can also think of uranium nitricum, sulfur, cephalandra, taraxicum. Taraxicum is given to a patient along with urinary complaints. One more important concern during the first 3 months of pregnancy is abortion, miscarriage, pretended abortion. And the drugs which are used for this concern are Sabina, Cicalcor, Vibrinum, where habitual abortion during 3rd month of pregnancy. Abortion due to excess exertion, in that case, you can think of Erigeron. Abortion with weak uterus walls, where the implantation gets difficult. In that case, you can think of calophyllum. Abortion due to some ovarian diseases, in that case, you can think of Apis mellifica. You can also think of calicarp. pregnancy with hypertension, gestational hypertension, in that case, you can think of glonine, Rauwolfia mother tincture, Nux vomica, Natramure. And coming to mother with thyroid disorders, both hyperthyroidism and hypothyroidism, in both cases, you can try this thyroidinum drug, which works excellently. Graphitis can be given to a patient of hypothyroidism who is elderly and also having constipation. Calcareous cart can be given to a patient with chilliness who always craves for indigestible things. Ferromate can also be given for hypothyroidism. When coming to hyperthyroidism, you can think of phosphorus, iodine, thyroidinum, Natramure drugs. In Natramure, there you will see irritability. You can think of thyroidinum where hyperthyroidism with protruded eyes, and iodine with sudden weight loss. These are few concerns which make the first trimester risk.
Right, ma'am. So as you have elaborated on hypertension, diabetes, hypo and hyperthyroidism as the major risk factors, which are to be taken care of during the first trimester in case of high risk pregnancies. Thank you, ma'am. Now, if next we could move on to see if there are some cases in which there is deficiency of amniotic fluid. So I would like to ask Dr. Mookambika if there is anything from our side which could be of help to such patients.
Okay, so amniotic fluid, when it is less, okay, usually I guess we term it as oligohydramniosis.
Yes.
It can happen like when there might be slight rupture in the women's, membrane. So that time there could be, leaking, and then, it can go down. Or sometimes the placenta could have some obstruction where, there's obstruction of blood supply and the amniotic fluid is less. Usually what we see in the other system is usually they try to hydrate the women and try to put them under IV. That's what we usually see. And actually, I would not like to tell that we have 100% scope on this, but definitely there are some remedies like the Cali-Mure, Natrum-Mure, preferably in some lower potencies like the 6th potency, where it actually, 6th potency means it becomes lower, and it is more like the sodium and all. So it retains the water content. So usually we give it for the hydration and for like people who are dehydrated and everything. So if we have a proper, a support system or supportive treatment is there, and along with that, if we are able to give this Natrum-Mure at lower potency or Cali-Mure at lower potency, definitely there are chances like you can rehydrate the women, and there is possibility of this amniotic fluid to increase, as well as the China also, like we see it has the loss of vital fluids, right? So even that could help in things. But again, we have to find out the cause of that particular thing, why oligohydramniosis is there. So with the help of the again, we have to have that supportive system, and we can have this. So these few remedies can help, like Cali-Mure and Natrum-Mure and China as well, but usually in the lower potency, it can help us.
Right. So investigations with the right diagnosis along with our supportive medicines would be of
Yeah,
help.
yeah,
Right.
definitely.
Right. One more thing, ma'am, here is if the amniotic fluid is normal, there are some cases in which there is a low-lying placenta, and which is a major risk factor for bleeding during pregnancy. So is there anything that we can do from our side for such patients?
Okay, like if do you mean like placenta previa kind of cases?
Yes, yes.
Okay, so usually maybe in the second and third trimester, we expect the placenta to ascend up so that, there won't be any bleeding or any kind of, abortions, correct? Again, this is one of the challenging cases, of course. So if we have supportive systems, certain bleeding remedies can definitely help, in the clinical repertories, Murphy especially. Babravi ma'am can correct me if I'm, So in clinical repertory, especially Murphy has given specific thing for placenta previa, like certain bleeding remedies like Sabina, the sepia, then you have ergron. I guess ma'am also mentioned once ergron, and this epicac as well in case of arterial bleeding or something. Again, a 30 potency or something we can give. Actually, there was a similar case like what you have asked. There was bleeding because of the placenta previa. So I have noticed during my MD time that our madam, she had administered sepia as well as Naxvomica. Both of them, I guess, it covers, and sepia especially for the weakened uterus, and then in case of placenta previa. So when it is given together complementary also, we can prevent, like after 2 months, what happened is she came up with her healthy baby. So we understood that it literally stopped. Whereas if we see the other system, usually they advise the lady to go under complete bed rest, and then probably if she is approaching the 8th month itself, they go for the C-section. But this particular lady, she was helped with the sepia and Naxvomica, as it complements each other also. So I feel certain, bleeding remedies like Sabina, ergron, epicac, and then sepia could help with such, but it is a risky condition. We cannot.
Right, but we definitely have a scope in such cases.
Yeah,
also.
yeah. Yes.
Yes. It has to be integrated with.
Yes, yeah.
Right, ma'am, and there is one more condition in which there is cholestasis. Cholestasis these days is very commonly seen in pregnant females. Yeah. So is there anything or any remedies which could be of help to such patients?
Yeah, cholestasis, especially during pregnancy. Yeah, this is a nice question. Why? Because usually the progesterone level will be more in the pregnant ladies, and usually this progesterone reduces the action of the smooth muscle contraction all over the body. So even though, so that's why most of the ladies have a lot of GI issues and discomfort, because the gallbladder is not emptying the bile. So that's why this cholestasis comes up. So some of the remedies where, which helps, like for the liver, especially bryonia, then your diascoria, chelidonium, can actually help in the lower potencies, especially this diascoria and chelidonium. It is clearly mentioned, like for the pregnant ladies, you can give, because of if they have the, GI issues and everything, which would cover. And because of this particular thing itself, because of this cholestasis itself, they also have this, eruptions or, itching of the skin and everything. So during that time, if we feel this is the probable cause, then definitely I feel like these remedies would help in the lower potencies. Bryonia, diascoria, chelidonium, of course, it can do wonders.
So the liver remedies, especially in lower potencies.
Yeah. Especially the diascoria and chelidonium. It has a very specific thing for the pregnant. We can think about it. And of course, Brai, we cannot forget. So even that could
help. Yeah. Fine, ma'am.
Dr.
Babravi, ma'am, there is one question which I would like to focus on. Like, if pregnancy and labor are one thing, there are few things which come up after labor. And the most important challenge there lies with lactation. And women these days are really worried about this issue. due to work stress and all. So is there anything that we can help to address this issue?
Lactation is one important aspect of woman's life, which will nourish her baby and which will give immunity, natural immunity for the baby. So lactation, decreased amount of milk production is one major issue, which is a major concern of mothers. In that cases, we can think of remedies which will affect breast and also which will keep the breast nipples healthy. In like that, we should think of remedies, and remedies which help for this lactation are lac defloratum. Lac defloratum can be given to the patients who are agalactic, and it will restore the milk back. I have given alpha alpha 6x to increase the quality and also quantity of milk to a woman who has conceived through procedure IVF. She gave birth to twins. For her, I gave alpha alpha 6x every day, morning and night. Her quantity and quality of milk was increased. And one more drug we can think in this way is Agnus cactus, Asafoetida, Urtica urens, and Resinus communis. These are the drugs which help in increasing the secretion of milk from the breast. And also drugs like sulfur, Sticta are also helpful for increasing. Sticta can be given in for those patients who have very deficient milk production. Lactuza can also be given for those patients who are with low milk productions. We can also think of drugs which will help in maintaining the healthy status of the nipples, like nitric acid, zinc, lecithin. These are the drugs which help in increasing the milk production and helping the mother.
Correct. So if these remedies are there with women after delivery, so definitely half the challenge is won. Now, next, I would like to ask Dr. Mookambika. There is one more disease, we can say, or an epidemic of postpartum depression, very commonly seen these days in patients after the delivery. So, which remedies could be of aid in such conditions? Okay.
Yes, madam. Like, so during the postpartum depression, okay, fine. This is actually one thing. Like sometimes we also call it as baby blues if it is only for a few days. But if it is trying to continue for quite some time, and then like if the lady has a history of depression, definitely we can expect like with her appetite changes and then that mood swings, and she tries to not have interest with the baby, she avoids feeding the baby, or sleeplessness is there, sad moods, then feeling of worthlessness. So depending on these symptoms, like we get remedies like sulfur, which can have the disgust of life and all that, or can come up. Then Silicifuga, okay, and we have the Tuja. Tuja again has that salvation, or they would like to go. Then Lilium Tig in that way, has that torments about salvation. They feel like some sin they have committed, and a lot of guilty feeling will come up. So in such cases, all this other, even the anacardium. So usually what we tend to give for the depression only, if we also try to inculcate, so these will help with the ladies during the postpartum. But definitely she needs a lot of help from the family also as well, even they have to understand. So certain remedies like these sulfur tuja, then anacardium, and then your lilium tig, sinisifuga and all can be of great help actually in this postpartum depression.
Right. So these drugs would definitely avoid the consultation with a psychiatrist and avoid the
Yes. Yeah.
Right, ma'am. So next question for Dr. Madhavi. Ma'am, there is one more question even from the audience also, that fibroid uterus is a very common thing these days in the middle-aged females. So especially in fibroid cases, we see there is a lot of profuse bleeding, prolonged bleeding, menorrhagia, metrorrhagia. So are there any specific drugs which could help us arrest this bleeding?
Madam, we have very good number of drugs to arrest menorrhagia or metrorrhagia, which is common in fibroids. So here fibroids also very common presentation, common cases. Most of the cases in our OPDs will be fibroids. If you take a comparison after PCODs, you will have more number of fibroid cases nowadays is more, they are coming more. And the age also from 35 to 45, sometimes 50 years or women also will be having fibroids. So that is common presentation nowadays. So here we have a lot of scope in homeopathy to deal with fibroids without going for hysterectomy. So nowadays fibroids bleeding means everyone will undergo hysterectomy. That is becoming very common surgery nowadays in females. So we can avoid this surgery by our drugs. So constitutionally, we can give many drugs to decrease or to cure the fibroids. And also during bleeding, they complain with menorrhagia, they come with menorrhagia or metrorrhagia. So for that also, for acute, to stop the bleeding also, we have very good number of drugs, I say. So like erigeron, millifolium, trillium, thalassepy. So thalassepy is also very good drug which helped me in many cases to cure bleeding in fibroids. And ustilago is also there. So these are to control bleeding. So after bleeding is controlled, you can go for constitutional drugs also. Okay. Trillium is there, very good drug. And in AMN is one more good drug for fibroids, arum, muraticum, natronatum. Okay, that we can give in 3x potency or 6x potency, that we can give. And also Fraxinus americana is also very important drug for fibroids, that is available in mother tincture form. So that also works in fibroids if constitutionally we are unable to get the drugs. Okay. Other than that, we have the drugs like phosphorus, sabina, belladonna, okay, cyclamen, ferromet, ipecac. So all these drugs, they help to control the bleeding. And also to cure the fibroids, we have drugs like calcarea floor, and laxasis, lycopodium, calicarb, calcarea phos. All these drugs, they also help in curing the fibroids. Okay, no need for going for hysterectomy, but patients will be in panic state if they have bleeding. So we have to take care of
the
that.
first thing is, if we take care of the bleeding, then the patient sticks to us.
So we should say first only that it takes at least 2-3 months, and we should inform so that they will gain confidence. So if once bleeding stops means, then we can go for other.
So remedies like smaller remedies like erigeron, millifolium, trillium, and along with the thalapsy, mother tincture, ma'am.
Mother tincture, Fraxinus americana. Yeah.
Right.
AMN
is also AMN in lower potencies. Yeah. That's really great.
Okay.
Fine. And next, I would like to ask Dr. Babravi. Ma'am, in the elderly patients, usually what we see is osteoporosis is the most commonest thing coming up. So in spite of taking good amount of nutrition or supplements, calcium, vitamin D supplements, also this condition is very stubborn. So as homeopaths, how do we help them, ma'am?
Osteoporosis is a common condition which we notice in our daily clinical practice, and a lot of cases are increasing. Though in spite of proper nutrition, the osteoporosis cases are increasing. One thing, the main important cause for this osteoporosis in an elderly woman is after menopause. After attaining menopause, the calcium metabolism is not happening properly. That is one of the important cause for osteoporosis. And this osteoporosis is not a sudden change in women's life. There are a series of events which are occurring. So basing on the events, we have to take the case, we have to give the medicines basing on the totality of the case. In osteoporosis, we can think of symphytum, ruta, calcarea fos, and asafoetida, calcarea floor, Merck, Silesia, and also we should counsel the patient to be in sunlight to reduce this vitamin D deficiency, and her diet should be proper with a lot of green vegetables and full-fledged nutrients in their diet.
Right, ma'am. So along with the nutrients and along with the exposure to sunlight, I think our remedies, which you mentioned, definitely help in improved absorption of calcium from the diet. Right, ma'am. Apart from this, ma'am, there is one more condition which is on a rise in these days. We see lots of patients, especially in the menopausal and post-menopausal age group. So the cause is, what happens is a young woman with good estrogen amount is immune to all the lipids which block to the arteries, right? But in menopause, this challenge begins. How do we protect this menopausal female from hyperlipidemia or cardiovascular complications?
Hello, madam, am I audible?
Yes, ma'am.
Yes. What happens in this menopausal woman? Why there will be building up of cholesterol in the arteries? The main important, the conversion, the cholesterol metabolism is inhibited. The conversion of cholesterol metabolism into estrogens, androgens is stopped after menopause. So ultimately, it will land into what accumulation in the arteries, resulting in cardiovascular diseases. In that cases, we can think of this colostrinum drug, Feltaury drug, which helps in decreasing cholesterol levels. And also, we should ask the patient who attained menopause for screening of this lipid profiles for every 6 months. Other than this, we can also think of Cretagus, digitalis, Epis, Arnica, Belladonna. These are the drugs which help in reducing the problems because of blockage of arteries with lipids.
Okay. So, ma'am, these drugs like colostrinum and Feltaury can be given in lower doses as a preventive?
Yes. It will, like colostrinum 6s, I have tried. The results are good. Feltaury is also given in 6C potency, morning and night for 3 days, followed by simplex. That also results are good. So we can try these drugs in our practice.
Okay. So drugs like colostrinum, Feltaury, and Cretagus, Apis, Belladonna, Arnica. And we have to repeat the lipid profile every 6 months. Right.
Yes.
Next, I would like to address Dr. Mookambika. So women account for like 85 to 90% of all the autoimmune diseases like SLE, RA, etc. So as a homeopaths, we agree that all these diseases have a psychosomatic origin. So how can we manage such cases with our drugs?
Okay, madam. Actually, what you have asked is correct. It has a psychosomatic relation, of course, all the autoimmune disorders. Why? Because autoimmune itself means the cells are trying to kill us from within. Okay, so the thing is, yeah, definitely there might be for some individuals then genetic causes which is triggered by environment, as well as you have already mentioned, because of the psychosomatic involvement is there. Mostly, sometimes we can see in females, some of the females have the habit of blaming themselves or taking a lot of regret on oneself, or they might compare with others and start hating oneself. So when there is hating of oneself and having a regret on oneself, or feeling guilty about something which is happened a long before, and but they are carrying it over years and years, they're not able to forgive themselves. What is happening in this meanwhile is, our cells also is starting to hate oneself, and it starts destroying one's own self. So here is where a lot of autoimmune reaction starts up and everything. If we see the other system, they go more for steroidal, things, either topical steroids or oral steroids they take up. But here I have personally witnessed and also prescribed for psoriasis or rheumatoid arthritis more, where the ladies, we have to take the case little in detail to know whether she's having any causes which she is not able to forgive or having a lot of regret. So once you get the cause of like that, then we can definitely start a treatment. But the treatment cannot be a sectoral treatment. It has to involve all her mind and body aspects as well. So depending upon the seat of action also is important. We usually, like for certain cases, we tend to go for, like, if again the intensity of the symptoms matter. So if it is very acute and she's not able to tolerate, means for the RA and arthritis condition, we go for the rustox and bryonia and things. Or if it is psoriasis or any other SLE conditions, we tend to go for sulfur and give one potency. Like usually we better start with the 200 potency and then wait for some time to see the reaction. As well, you have to give her the confidence of what she is lacking within herself. So this definitely, autoimmune definitely has a psychosomatic relation, and with complete constitutional approach, definitely we can go with drugs like sulfur, natrum, rustox, sometimes Oramet, and all those polycrest remedies. Sepia, in fact, can help in many of the conditions which involves the autoimmune. And if we have to see miasmatically, some of this go all the tri-miasmatic, or as a autoimmune thing, it completely goes for syphilitic. So anti-syphilitic remedies also, we can keep in mind and prescribe accordingly, would definitely do wonders.
So focusing on the remedial aspect, the miasmatic aspect, as well as counseling.
Yeah, mind
right.
counseling
is the right approach in such cases.
Yes, definitely.
Right.
And we do have scope. It's not like,
exactly.
because when we compare it with the other system, they go only with the steroids, and the steroids, in fact, give rise to many other issues. But with
Correct.
us, definitely we can cure them.
Correct.
So until and unless if it has gone for so much deep pathology and it has become incurable, then more of, palliative kind of treatment. But still we have, like,
so definitely we can start with our treatment simultaneously and then slowly taper off the steroids.
Yes, definitely, madam. Taper off, and we can take up the hand, and we have in fact given a lot of cures for rheumatoid arthritis, and then which are at the initial stages, and also the psoriasis, which also comes under the autoimmune disorders.
Right. Ma'am, one last question I would like to ask. As we already had a discussion on the effect of UTIs in pregnancy. So also UTIs are generally very common among elderly women, or especially women.
Yeah.
Right. Yeah. So how do we deal with this? And these usually are very recurrent and they are stubborn. So how do we approach such cases with homeopathy?
Okay. So usually urinary tract infection, definitely we consider the women point of view, because of the anatomical structure, the urethral, size, and the proximity of the, urethral opening with the vagina and the anus. We tend to get more of infections and much quicker. So usually if it is like can be divided into lower urinary tract and upper urinary tract. One of the, like, we can treat like symptomatically, but if we see the recurrency also, like usually in the menopause time, the female gets frequently, or if the hygiene is not maintained properly, she can get. So what we can actually see is sometimes the patient might not have symptom, but when she goes for USG, and then if we find out the bladder is inflamed, and this, so we can also find out she's having recurrent UTI. And recurrent UTI means within 6 months or a year, 3 times she might get the episodes of UTI. So in such cases and all, first of all, yeah, previously even madam has mentioned, uh, we have to prevent and teach the women what are the proper things. So this is like one aspect, like hydrate yourself during like hot climate. Definitely you have to go for the double amount of whatever usual intake of water, and especially the cranberry pills you get. They're like juice also we get, but cranberry pills you can take, so that you maintain the probiotic bacteria. Now again, if we focus upon recurrent, if we see, usually we have to definitely send them for certain investigations, like urine analysis and culture. Sometimes what we see is some people keep on taking the antibiotics. Some it could be, in the culture sometimes you might not see the bacteria which are actually causing. And if it is not because of a specific bacteria and you keep on taking the antibiotics frequently, what happens is you are killing the lactobacillus, which is a good bacteria and which is required. So again, what is happening, she will get infective UTI. So again, this becomes a cycle. So you don't check it properly, and then you keep on taking antibiotics frequently, and then again and again there is possibility of UTIs. So for all this, like in order to be so here we have an upper hand, like we can have different remedies like Epis, Cantharis, Tuja, and especially in chronic cystitis we have the causticum, which has a upper hand, and then sarsaparilla, Tuja, acid, benzoic acid, especially maybe for the growing girls. But for chronic things, we usually think of causticum and all that. So along with the general management, and also with our these drugs, we can have a good treatment upon this. So as well, lab investigations are also important, and frequently if they go for antibiotics, it is not of help. So that is also there.
Right. So we definitely have upper hand in treating acute as well as those stubborn and recurrent cases. Right. Thank you, Mookambika, doctor.
Yeah.
And so finally, to wrap up the session, we have seen that homeopathy has an upper hand or has a definitive role in each and every condition pertaining to women, right? So definitely homeopathy is the woman's best friend. And I would like to thank all the resource persons for pouring in with their personal experiences, sharing their clinical experiences so beautifully. And it has been really a very useful session.
Yeah, Dr. Annapurna, I would like to say one remedy which I have used in my practice, and I feel very wonder after giving that medicine. Simple pains which we will think of the rare remedies. It will cured by that remedy, like a macrotinum. Macrotinum is that in the 3x form. I usually give for that lumbago backache cases, and especially in menses, during menses. So macrotinum in my students, even for my clinic patients. So like in my relatives, females. So I usually give, and only two tablets of macrotinum. It's a tissue remedy. Tissue 3x form. Actually, it is an alkaloid. So that will immediately relieve that back pain, headaches, lumbagos, like all this. So it's such a wonderful remedy again. And I have seen someone asked about that lumps in the mammary gland. Yes, we have lot of scope in that, like we call fibroadenomas of that breast. So fibroadenomas of the breast, basing on the symptoms, we have conium, phytolacca, bryonia. We have certain remedies which having the affinity of towards the mammary gland, and it wonderfully cures, and no need of that mastectomy. We can go for this with remedies. Okay. And thank you, HMAT, for giving this opportunity to share my views and can listen all that experts we have, in number of cases of women in one platform. And Dr. Annapurna, Madam, thank you for your nice interaction with us. And a special thanks to Dr. Naveen, Jim's director, for giving and recommending me for as a resource person for this HMAT. Thank you so much.
Thank you, ma'am. Over to Gauri, sir.
Thank you all. I request the President, Dr. Gopalakrishna sir, to take over, please. Gopal.
Hello. Gopalakrishna sir.
Venu, am I audible?
No, sir. Audible, sir.
Hello. Am I audible?
Yeah.
Hello.
Sir, we can hear you, sir.
Hello. Hello.
Sir, it is audible, sir. You can go ahead.
Am I audible, Durga Prasad?
Yeah, sir. Audible, sir.
Yeah. Thank you, Dr. Venu. Yeah, I profusely thank all the distinguished speakers of this evening. So they have given us immense information for the benefit of all the practitioners. So as we all know, we have heard time and again that it is not only homeopathy is human friendly, it is also woman friendly. So much of usefulness we have heard and seen and experienced. So all this knowledge would be immensely beneficial to all the practitioners. So we profusely thank the resource persons, especially Dr. Rani, Dr. Madhavi, Dr. Mookambika, and Dr. Babravi. So congratulations to you and heartful thanks. And I also thank Dr. Annapurna for making this session very useful, live and interactive. Thank you one and all. Will you take over? Hello.
Venu, vote of thanks.
Okay.
Concluding remarks, and your concluding remarks with vote of thanks.
Okay, sir. Already we are very late, and our resource persons did not leave us any chance.
Concluding in a short way.
Yeah, information to be added. Really congratulate all the resource persons for this wonderful presentations, and Dr. Annapurna for making this session, as our president said, very lively and interactive. From our person, and we can Rani for experience in this state to us. And thanks to Dr. Madhavi, she has an immense experience also in treating fibroid uterus, premenstrual syndrome, and other with great from Hamza giving us some insightful info. There are so many things to be learned from this evening. Pituitary to increase the blood flow to the uterus. These are all new things, and they will go a long way in helping many women go through infertility and various other conditions. And last but not the least, Dr. Mookambika, very spontaneous, very lively, and extremely focused in her approach and presentation. Thank you so much to all these resource persons, and also to our lively moderator, Dr. Annapurna, for making this happen. We thank the family of Dr. A.S. Murthy ji for sponsoring this memorial oration.
Anything to?
Yeah, sorry for making this evening happen. The sponsors of Dr. A.S. Murthy Memorial Oration. We thank the good officers of Dr. Naveen Pavaskar from JIMS, Dr. Umesh from Hamsa Homeopathic Medical College, Dr. Manilal and Dr. Venkateshwar Rao from MNR Homeopathic Medical College. And we thank Dr. Murli Tumala, Vice Principal from Dev's Homeopathic Medical College, for coming out and giving us this wonderful resource persons who have been our great help on YouTube always, and I'm sure a lot more homeopaths will experience from this presentation in the days to come also. And we thank our the crew of Homeopathic Medical Association of Telangana for making this happen, our president and our secretary, for facilitating this wonderful evening, sir. Thank you one and all. And next month we'll be meeting for a special event on eve of Dr. Samuel Hahnemann celebrations. Week of last Sunday of every speaker as we have had this evening, and we look forward to seeing you all again very soon in less than a month. Thank you. Homeopathic Medical Association of Telangana. Thanks one and all.
Thank you so much, Venugopal sir, for giving this opportunity. And thank you, Annapurna madam, for moderating this session. And thank you, Durga Prasad Rao sir.
Thank you.
Thank you.
Thank you, sir. Thank you, ma'am.
Thank you, sir.